This episode of Spotlight Hawaii is brought to you by Chaminade University.
Well, happy Aloha Friday, Friday the 13th, here on Spotlight Hawaii. I'm Ryan Kalesuji, joined by Yanji Denise, and today we are going to be focusing on education.
That's right. We are so lucky this morning to be joined by the Hawaii Department of Education Interim Superintendent Keith Hayashi. He took the reins of that job not too long ago, and school just started. So, Superintendent, thank you so much for being here this morning.
Well, thank you for inviting me, Yunji and Ryan. Thank you.
We're so happy to have you. Let's talk about how school is going. You know, we had that breaking news this morning, over 1,100 cases reported, COVID cases reported in the state today. There are so many families who are concerned about COVID on campus. What can you tell us about how school's going so far?
Well, so far, looking at our data from last week, we report every Friday. And so we have about 105 cases as of last week. Considering the over 200,000 students and faculty and staff that we have in the department, our mitigation strategies are working. You know, for all of our schools, our principals and teachers and our students are focused on 4 core strategies, and that's get vaccinated, stay home if you're sick, mask, and hand hygiene. And those are the 4 strategies that we're focusing on throughout our system. In addition to other layered mitigation strategies that schools can additionally do to support students and safety.
If we can focus a little bit about those numbers that we saw, those 105 cases, as you talked a little bit about, what are you learning of that? Because that doesn't necessarily include just that first week of school. If you can give us a better context of how how that number came to be and what that is the summary essentially of.
So though that number is basically for the week, we have, if there is a case on campus, our principals do a really good job of reporting that to us, to the state, as well as doing some contact tracing and reporting that to the Department of Health. Principals there's a process and a protocol that we go through, and they notify the parents of any students that's impacted. If we need to quarantine students, then those students will be quarantined, notify the parents, and just address safety as a whole. So those numbers, if they do increase, we'll continue to address them through the work of our school administrators and teachers.
I want to bring in this question from Alana Diaz, who says, what is the threshold to close the schools? Is there a certain number of cases or hospitalizations? Of course, we don't want to see any schools closed. School just started, and so many students are probably so happy to be back among their peers and with teachers in person. But at what point do you close a campus, and at what point do you have to close an entire complex?
We are working very closely with the Department of Health. They've been great partners in working together with the DOE. And when we look at contact tracing and looking at the impact at schools, the Department of Health has also prioritized the DOE and they have assigned additional teams for contact tracing so they can help us to monitor what's happening at the schools. So if it ever gets to a point where we need to make those decisions, we're definitely going to be working with DOH and before any decisions are made. So working through the Department of Health.
If we can also talk a little bit more about just the testing availability that may be an option for those teachers. We have some parents out here who are asking, why aren't we testing more? Why aren't we having more opportunities and availability for testing that may be made available for not only students, but teachers and staff? Is that expanding testing efforts in the plan at all? And if you can talk a little bit more about any of that sort of mitigation that might help to determine if COVID is on a specific campus.
Sure. We do have partners that we're working with. We did in the beginning of the year. We partnered with what's called ICAT, and through that program, we did offer testing to schools as a pilot. We are working with different providers and with the Department of Health to see how we can expand some of that to offer that to other schools. So that is definitely an ongoing project that we're doing, and to help to build additional opportunities for our schools. We are prioritizing areas that may need additional support related to the number of cases that are in the area. So it's very strategic in how we're doing that. So that is something that we're working on, most definitely. And if I can,
well, please go ahead.
no, yeah. If also when we look at testing, I just wanted to kind of add too that it's related a little to athletics, and I know that's been a question for people that why are we saying that why do we make the decision that September 20th, September 24th would be the day that students need to be vaccinated in order to compete in athletics? And why wouldn't we just allow students to get tested? Right, a little bit to what you were asking about with testing. And as we're looking at the variant, the COVID variant, and in consultation also with the Department of Health, we made that decision for a couple of reasons. One was because prioritizing in-person learning was really important to us, and it's always been a focus for the department and for our schools to ensure that our students can be in school learning, and also we wanted to preserve athletics. And although athletics would start a little later, with all of the students vaccinated, that would ensure that hopefully we do have a season. You know, in the preseason, we had cases. A case that's, for example, at one high school in the preseason, there was a positive case, and because that student wasn't vaccinated, and the other students were not vaccinated, the whole team had to quarantine. You know, and not only that team, but the team that they played also had to quarantine. And so from that, and then the game the following day was canceled. So from that one case, it impacted, I believe, 6 or 7 teams. You know, and just from that example, you know, that situation, we really took a look at what do we need to do to put in place. Testing was one of the things we looked at, but we felt to really ensure that we have a season. That's when we decided to implement the September 24th date for testing. And from the September 24th date, the acclimatization process would start to ensure that our students are competing safely so that we can have a season. So that's kind of a little related to your testing question.
You know, following that same logic that one student's exposure can have a tremendous impact on those around them, why not mandate vaccinations for all the students that are on DOE campuses? Is there any thought to having all students who are eligible for vaccinations be mandated, in addition to the student athletes, just looking at the wider student body? Have you had those conversations, and is that a possibility?
That discussion, that decision is a decision that the Department of Health will make. There are vaccinations that are already mandatory for schools that have been determined as such by the Department of Health. And whatever protocols that they need to follow to make that decision, we would abide by that. But as of right now, it is not mandated, the COVID vaccine. So that's not something where the Department of Education can require for all of our students. However, athletics is an extracurricular activity, and it's by students' choice that you're participating in it. So as such, we do have the flexibility and the latitude to require the vaccinations.
We're getting a lot of questions here about distant learning options and what options are being made available for those parents who feel that schools just simply aren't safe enough to send their kids back, and maybe the lack of options that are being presented at the moment. Can you explain a little bit about the distant learning options and what you and the department are looking at to expand those options if parents feel that campuses still aren't safe enough?
Sure. You know, at the end of last school year, the focus was on all of our students returning to school for in-person learning. And as things evolved with the variant, it became clear that we did need to offer some kind of a distance learning option for some parents who felt that they wanted their students in that option. I really need to credit the schools, the principals, the teachers, the administration at the various schools, at the complex areas, for in a very short period of time, standing up distance learning options at the respective schools, complex areas, and even at the state level. To be honest, as a former school principal, I was really hesitant and wondering, how can we do this? But to see what happened at our schools, having options for parents was, in my mind, was incredible. Looking at the state level, at the state office, again, standing one up at the school level is in a short period of time is very difficult. But to get a system in place that we can offer for students from different complex areas, I think they did a really good job. Currently, we have about, I want to say about 200 students who are in elementary, K-8, that elementary and middle school, that are currently waiting to get into the state program. We do have the positions there. What we're waiting on is hiring teachers. We have hired teachers, I would say about maybe 3 or 4 of them, potential teachers, accepted the positions, and then for whatever personal reasons decided that they didn't want that particular position, which kind of put us back a little. So we're still in the hiring process. All of the high school students have been. There are no high school students in the state program. They've all been taken care of. So as far as the school level, the complex area level, and the state level, although we know we need to get those other students in a program, considering the number of students that we've had to address and accommodate and support, for me, I'm very proud of the fact that we're able to do that.
I just want to get a little more clarity, and there's some people asking about the numbers. So how many students are in distance learning programs right now, and how many are essentially waiting for that to become available?
I'm not sure exactly on the total number statewide. I can get that to you. I do know at the state program, we do have about 200, little over 200 students that are waiting to get into the program. Other than that, I think we're okay at the state program.
And so those who are waiting, they're simply waiting because you folks are looking to essentially hire teachers that will fulfill the positions of being these online teachers. Is that correct?
Yes, that's correct. In fact, I was just talking with them a little while ago, and we have put 3 more teachers that we're interviewing on Monday, and hopefully if we can get them in, that's roughly it's about 90 more students that we can accommodate. And so the quicker we can get the applicants in, get them hired, we'll be able to address those students who are not yet in a program.
I want to ask you about vaccination rates among the DOE as a whole. The governor made news last week in requiring all state and county employees to be vaccinated or get weekly testing. What is the vaccination rate, as far as you understand, of teachers? And then of course, there's so much support staff on campus. How much farther do you have to go to reach the governor's mandate?
We haven't currently assessed the total number of teachers and staff that we have vaccinated. We will be having later today the process that'll be coming out to all of our employees on what that'll look like and what that process will be. So we'll hopefully be getting that very soon.
There seems to still be just a lot of questions about options and just making sure. I think parents just overall are concerned. I mean, you look at the numbers here that we're seeing today, and obviously there are a lot of people just in the community who maybe don't have kids that are scared. And then you think about these parents that are having to make this decision to send their kids to school during this time. I'm wondering if you can shed a little more context about the testing process. I mean, I know that you kind of broke it down at the beginning that it'll be tested and that those numbers essentially will be released at the end of each week. Do you think that that is enough time that is a good gauge for this testing? Should that be done more frequently, so to speak, so that these numbers are released in a more efficient manner rather than waiting to the end of the week? Are you comfortable with the way that this format is being set up, with these numbers being released at the end of each week that dictate what happened that week for each of the campuses?
Yeah, I think right now, looking at the numbers that we have, the 105 students, most definitely we would want that number to be 0. But what we're seeing with that increase, 105 students out of 105 cases. I'm sorry, not students, cases. Both students and adults of roughly 200,000 students and employees. If we do need to make adjustments, we're watching the data. If we do need to make adjustments as we move forward, we definitely will do that, both in consultation with the Department of Health and our school leaders. But as of right now, we're reporting it at the end of the week. We also have a website on our DOE website that has reporting by that is updated weekly.
I want to ask you about those mitigation measures. There's a lot of people who are asking about just the classrooms themselves. We know that overcrowding was an issue before COVID, and that ventilation was also an issue. A lot of classrooms lacking air conditioning, and right now you'd want the windows open. I mean, what is being done to make sure that when the students are in class, that they are kept safe?
Right. So again, we do have those core mitigation strategies, where number one, to get vaccinated. Number two, if you're not feeling well, if you're sick, stay home. That's really important. To mask wearing. Indoors, everyone's wearing masks. If students want to wear a mask outdoor, they can if they want to. Some schools are also asking students to wear masks outside, especially at the secondary and at the high school level. At the elementary level, when students are outside, they're in their Ohana bubbles. So, we are cohorting students. That's another strategy that we use. Hand hygiene is the last core strategy. Be able to make sure you're washing your hands. Don't be touching your face and your mask and so forth. Distancing is another strategy. But what we're really focusing on is those 4 core strategies, in addition to the other mitigation strategies. And I think, when we look at what our teachers and our administrators and school staff are doing, I really think they're doing a really great job. So for our parents who may have concerns, I want to just assure you that our school staff are working really, really hard to help support and to the best of their ability to ensure everyone's safety.
I wonder if we can explain a little bit more about the cohorts that you had just mentioned. So essentially, these are the same students that would stay together throughout the day. One teacher, or the teachers rotate, but the students maybe would stay the same to limit the exposure overall. If they're staying in the classroom together during this time, does that also mean that after school they're kind of released at the same time? How do you ensure these cohorts or these bubbles remained intact if before or after school they essentially are intermixing with other students from other cohorts? How are you managing these cohorts and keeping these, so to speak, bubbles together?
Yeah, schools have done are implementing different strategies, and we're basically each school principal and their staff know their schools best. So they're implementing different things, and so some work with their students and have them go straight to class when they're dropped off by their parents. Some students, as they wait outside, they may be cohorted together in front of the class, distance, with their mask on. There are a number of different strategies that schools are using. During recess and such, when you drive past schools, sometimes you'll see these markers that are up. And that's where when students come out, they stay in that marker area in the Ohana bubble during recess and times that they're out on campus during the school day.
Yeah,
We
there are
also
a lot.
we cut yeah.
Oh, sorry. There are a lot of questions about social distancing. Jennifer has a point here. She says there's no social distancing on the bus. The buses are packed. I mean, you are limited by the resources that you have. I assume that you can't have the bubble be on the same bus. They don't necessarily all live in the same area. So how do you manage something like that? Because yes, you have the bubble, during the school day, but a lot of parents are saying, look, after school or at lunch, these bubbles are essentially broken.
We do encourage our families who are students are riding the bus coming from the same family to stay together. The bus windows are open definitely to ensure the ventilation. Students are masked on the bus, so we are implementing those strategies to the best of our abilities. And so again, when students come off the bus, we do our best to ensure that they're practicing those core strategies, which include wearing their masks, staying home if they're sick, um, washing their hands when they get to class. I know a lot of teachers do that when students come in. The first thing they do before anything else is, washing hands in class. And again, for those students who can vaccinate, we very much so encouraging vaccination.
As the interim superintendent here of this, the education system here in Hawaii, in speaking with your predecessor who was in this role, one of the things that she spoke about, the challenges that she faced were just overall the budget shortfalls in ensuring that this department can continue to move forward during non-COVID related matters. You add in COVID-19, it's adding a whole nother layer, of course, of expenses and things that the department has had to set up, from distance learning opportunities to just making sure that each classroom is safe and children and students and teachers are also safe. If you can speak a little bit about the overall budget right now and what you are facing in terms of shortfall, what you may be asking the legislature for support, and are you hearing that you're going to get that support, because we know that this was an issue of the last superintendent?
We're going to definitely make sure that we communicate our needs to the legislature and to the governor, and they've been very, in my time that I've been here, in the last, this is, I think, like my ninth day or something like that, in meeting with the different legislators and, with the governor and the Board of Education members, I started off by saying, we can get through this if we all work together. And the meetings that I've had with everyone has been very supportive and prioritizing education. And I think I'm really looking forward to continue to work with everyone, because they have prioritized education and looking at how we can support our students. As we're very fortunate also, to get some federal monies to help support what we're doing with, American Recovery Act funds through ESSER. And so, we're definitely going to leverage that to the best of our ability to support our students. Again, that's the focus, right? Ensuring that our students are learning. In addition to funds that already have been sent down to the school level through weighted student formula and other federal monies, our school principals working with their schools have been working really hard in prioritizing 311. Right? It's again, ensuring that our students are in school. The attendance is important. Looking at academics, assessing where our students are currently, and providing those necessary supports, and so assessing a socio-emotional component. How are students doing? Are they feeling safe? Do they have any concerns? Looking at those three areas initially, and providing those, assessing that, and then schools providing those targeted supports for students to ensure that we can move forward quickly as we return to school. That's three. And then the next one is looking at our staff and ensuring that our staff well-being, we're taking care of our staff. It's all about people, right? And so we want to be sure that everyone's feeling valued and we're moving forward. The last one is our system, assessing our system, where we're experiencing success, and if we have needs in certain areas, we address those. So really leveraging those resources, those fiscal resources, to support that effort. And I'm really feeling positive about again the support that I've gotten and the department has gotten in helping to move forward. Again, it's all about us working together to support our students, and that's really important.
You know, I'm just seeing so much frustration in the comments here by a lot of parents who say that when they were surveyed, if they were surveyed when Delta was not an issue. So only 2 to 3% of those surveyed said that they wanted to do distance learning. Of course, everybody would love to have their kids back, but now that we have the Delta variant, we have, you know, an average of over 700 cases per day in the state, and that number only seems to continue to rise. Will you be making more distance learning options available? And for parents who are watching right now and who say, you know, I didn't opt for that, but now I'd like to, what do you advise them to do?
You know, we're going to be doing our best to assess the need and move forward as you know as much as possible. You know, there are when in standing up any program, you know, again there are we need to look at different issues that come into play. Personnel is one of them. You know, having to hire teachers to support programs in different ways is important. Looking at curriculum, overall needs. There's a lot of things that factor into moving forward. But definitely, as a department, you know, we're always looking to improve on our services and how we can support people. So, you know, we'll be definitely taking a look at that moving forward.
We know, again, as you mentioned, that this is your 9th day, I believe you said, on the job. If you can, as we wrap up here, unfortunately, we are close to running out of time here, but did want you to just provide your thoughts, your first maybe few days here on the job. And is this a role that you would like to permanently be in? Do you plan to apply and seek out this job as a permanent position?
You know, yeah, the quick answer to that is yes, I am. You know, it's an honor for me to serve as interim. When the last time that I was I was fortunate enough to be in this position as an interim superintendent. I was only for about a month. It was a different environment, you know, and we didn't have COVID 4 years ago, so it is very different. But I think the thing that's consistent is the commitment of our educators and of our people in the department. I mean, it's so inspiring. As I've been visiting, I went to a neighbor island this past week, visited schools there. I visited with our state office employees here on Oahu. I've been able to meet with other complex areas and area superintendents. You know, and it's so inspiring when you really talk to the educators and you listen to them, and the effort that everyone is putting in to support our students is it's just priceless, you know. And it'd be an honor for me to continue to serve in this role and to support our students in our state.
Okay, well, Superintendent or Interim Superintendent Keith Hayashi, thank you so much for being here this morning. We've got a lot of questions in here from parents. We tried to summarize and get to as many as possible, and we welcome you to join us back here anytime. You always have an opportunity to talk here when you're willing.
Thank you, Eugene Ryan. Thank you very much for the opportunity. You have a great day.
You too. Aloha.
Aloha. Well, interesting to hear from him. He did say, you know, those of you who are noting the high case count today, that at the end of every week, they tally the cases that are related to schools, and they release that on Friday. So we don't have a number for this week. The number for last week related to campus was 105 cases. Important to say that some of those who were tested positive had not been on campus since last May, but we will be getting a clearer picture of what's been happening since kids have been back on campus sometime today when we get those final tallies.
And we also recognize that this broadcast is being aired during the same time that the governor and the Department of Health were also having a press conference. There were people asking if this would be recorded. You can certainly go back and watch this. This all lives, of course, on the platforms of the Honolulu Star-Advertiser online. So if you missed part of this conversation, feel free to go back. Some of the other things to highlight that the interim superintendent said is that they recognize that there is a growing need for distance learning options, but quite simply, they just don't have the personnel right now to help manage that. He said about 200 I believe the students, he said, are waiting in the system. They're looking for teachers to essentially manage the online and teach those online classes that they are trying to hire and bring on board. And so they are understandably noting that these are going to have to be options moving forward. But right now, they just don't have the personnel to help lead that area.
Yeah, and we saw so much frustration in your comments when it comes to distance learning. A lot of you wanting to know how you can pivot to that. That list of 200 students that are waiting, we expect that will likely grow as the case count can, increases in our community. He talked a lot about why they decided to mandate that student athletes be vaccinated. So you can go back. This is also available as a podcast. It'll be posted later this afternoon. So you can always go back and listen to it that way if that is easier for your schedule. But he talked about that decision. He said at this point, it's up to DOH whether or not they would mandate the COVID vaccine for all eligible students, sort of system wide. They're not at that point right now. He said it's not up to him. That really is a Department of Health decision. So we'll be watching that because that's got to be part of the conversation for sure.
Yeah, a lot that was covered. Encourage you to go back and watch that and hear more from the interim superintendent. Looking ahead to next week, we have another full week of guests. We will have joining us the lieutenant governor, who will, of course, be giving us an update. He has been very front and center with this pandemic and the numbers being reported since this all began. And he has become an active voice and an active role in making sure that people are aware of these numbers and breaking that down. So we're going to be breaking down the numbers that we see over the weekend with him on Monday.
That's right. So please do join us right back here, 10:30 on Monday. Until then, have a safe weekend. Take care of yourself and each other. We'll see you right back here at 10:30. Aloha.
Aloha.
This episode of Spotlight Hawaii was brought to you by Chaminade University.